as we heard, 2 more COVID-19 variants have been detected here in South Africa. And meanwhile, the World Health Organization has approved the emergency use of a COVID-19 vaccine made and produced in China. To discuss all these developments further, I'm joined by convener of the Progressive Health Forum, Dr. Aslam, who joins us virtually from just outside Pretoria. Dr. Dasoo, thank you so much for joining us. Quite a bit to discuss this morning, but I think let's start off with the latest news coming through overnight. The Health Department confirming that they have indeed detected 4 cases of the variant first detected in India, and there's also talk that they've noted 11 cases of the variant first detected in the UK. One would assume, going by what we've learned over the last year of how the coronavirus travels and indeed changes, that experts such as yourself would not be surprised that these variants have now finally been picked up here in South Africa.
Good morning. Good to be with you. No, not at all. We're not surprised at all. The virus respects no borders and means to contain it, as we've seen in the past with other strains of the virus circulating around the world quite freely, even though stringent measures of lockdown or border closures have been implemented.
What do we know about these variants that are different to, let's call it, the base variant of COVID-19 that was really front and center since the start of this pandemic? Is there anything that ordinary South Africans should be aware of with regards to these 2 variants that have now been picked up in South Africa?
Sure. So variants are a part of the natural life cycle of viruses, as we know. And, the variants that have caused a lot of consternation are those which increase transmission and or virulence of the virus. Now, of these, there are 3 variants of concern. That's the one detected in South Africa, in the UK, and in Brazil. And now, with the emergence of 3 new variants in India, these are now under serious investigation to see if they, too, would increase transmission and virulence. The upsurge in India indicates that is indeed the case, because you would not be able to find that kind of transmission with the original founder virus, shall we put it that way. But we are also very clear that this is not the last of the variants that will emerge. And with the force of infection, certainly of the kind we're seeing, tragically seeing in India, the emergence of more variants is inevitable. And these variants will have differing effects on the ability to vaccinate against it, and this will have to be constantly monitored and surveyed.
We find ourselves in a time of this pandemic, 1 year on, that we really depend on ordinary South Africans to help keep each other safe by being socially distant, by avoiding big public gatherings, by using sanitizer, and the list goes on. We know it like the back of our hand right now. Are you of the opinion that that would be enough to contain what some are expecting to be the start of a potential 3rd wave? Or should there be talk of potential lockdown levels being brought back up by the presidency?
Look, we're not going to avoid a 3rd wave. What we can do is determine the scale of that wave through the non-pharmaceutical interventions that we're all very familiar with and which we must now stringently apply, especially at this point. There's really nothing else that we have in our armory to protect people beside vaccination. So, barring vaccination, we have the non-pharmaceutical interventions, and we do know that you can reduce the peak of a wave and the extent of a wave just by utilizing those methods. But the 3rd wave is upon us. It is inevitable, and South Africa has now got to sit up and take serious note of what is to come.
Now, speaking of vaccines, one of the other pieces of news coming through over the last couple of days is the World Health Organization granting emergency approval for a COVID vaccine made by a Chinese state-owned company called Sinopharm. This is being seen as a pretty big deal. Why is that?
Well, we have a few already that have been approved for global use, for emergency use worldwide. And those that we're very familiar with, the Pfizer vaccine, the AstraZeneca vaccine, J&J, and so on. The addition of the Sinopharm vaccine to that arsenal is extremely significant. Firstly, we know that lower and middle and lower income countries are struggling to acquire vaccine. The COVAX facility that the WHO set up is now able to access large numbers of this particular vaccine, which has now been proved to be effective. And this is a game changer, I believe, for many countries. It's also important that we, it's a very good development that this occurs. And also the Chinese are probably capable of producing large volumes of this vaccine at this point. So this is good news for countries like South Africa and others who are way back in the queue in terms of acquiring vaccines and way back in the program to vaccinate their populations. So this can only be seen as a good thing.
We also had news this week that the United States came out and made quite a big statement saying that they would back any moves afoot to try and ensure that there'd be an IP waiver and make it possible for other countries, especially poorer countries, to produce vaccines at their own facilities to ensure that we get more vaccines into more parts of the world quicker and faster. What did you make of that announcement by the United States?
I think it's a very significant announcement. The TRIPS agreement at the WTO, which is what you're referring to in terms of the waiver, has been a very long fought and fraught affair among countries who believe that such kind of intellectual property restriction during times of crises are unwarranted and such waivers are necessary. Now, it's always been a case where the more powerful countries, richer countries, have decidedly been against this development because pharmaceutical patents are part of the global IP patents regime, which is fundamental to modern capitalist trade. So if you are going to have a waiver on this, it's very significant, and you can be sure that the countries who all finally agree to it will be very careful not to leave a chink in the armor of patents. That's the first thing. Second, there will be huge resistance, particularly from pharmaceutical manufacturers, if the waiver is comprehensive. So what I suspect is likely to happen in the short term is a voluntary licensing occurring. That is where the patent holder allows other companies to manufacture the vaccine, like Aspen is doing for J&J here. In other words, fill and finish. This is in order to create volume of production because the pharmaceutical company itself may not be able to create the volumes necessary, certainly in this pandemic. So we might find that the WTO is able to quickly move now with the support of the United States to mass voluntary licensing. There are many plants around the world that can do what Aspen can do and greatly increase the supply of vaccine.
Dr. Dasoo, just one more question before I let you go. We're talking about all these vaccines, different things being taken out of the way so that we can get vaccines to countries as quickly as possible. We've heard here in South Africa, every day almost we're hearing that there's a batch expected on such and such a day, so many million, the numbers keep being thrown at us. This is how many vaccines we are expecting or already in the country. But we're not hearing the same kind of reportage around how many of those shots are making it into arms here in South Africa. There's ongoing talk about the rate of vaccinations not just being where it should be here in South Africa. What is your take on our rate of vaccinations in South Africa at the moment?
Well, in short, it's woefully inadequate. We're on a continent where other countries are way ahead of us in terms of vaccination. Now, this is a historical a reason. We know that we started late in terms of acquiring vaccine, and then we've had a couple of unfortunate events, such as when the AstraZeneca vaccine landed here, which the president procured urgently through his counterpart in India. That was a milestone, and on the same day we find out that it's not as effective against mild and moderate illness, which should have quite rightly allowed a pause. But after that, it was clear, because it was very effective against severe illness, hospitalization, and death, it should have been administered to as many South Africans as possible. Instead, we sold it off. And we were fortunate to get the J&J batch of 500,000 under trial so that we could at least start with the vaccination of health workers. This, too, was paused when there were side effects found to this vaccine in the United States, but which had very little bearing on us. So it was an unfortunate decision again. We lost a couple of weeks. That has now resumed. But our total vaccination is under 350,000. And this is of great concern, especially if we are trying to reach millions. We don't have the supply, and security of supply is a huge problem in any vaccination program, given the conditions of this particular virus, how it variates, and so on. But here's another problem that we have. So Aspen was supposed to have produced the J&J vaccine, or filled and finished the J&J vaccine for use in completing our phase 1 with health workers and producing more for phase 2 and 3. The batch that they filled and finished came from a plant in Baltimore in the United States, which was shut down because of serious manufacturing irregularities. This now has come to light, and Aspen and other companies which took batches from that plant now have to delay quite significantly and do serious quality assurance and safety checks. So these exigencies are going to arise all the time. It doesn't help that we are on the back foot, that we started late, that we don't have additional supply, like in the United States, who could afford to pause the J&J because they have other vaccines. We don't. We have now a batch, I believe, of about 320,000 Pfizer vaccine that have come in. That's about enough for about 150,000 people. And, when that's done, we don't have any more vaccine except the promised weekly supply by Pfizer, and whenever the J&J one now becomes available. So we're in a very difficult situation going into the third wave. It would have been ideal in the past few months had we rolled out as much vaccination as possible. We might have had a huge effect on the impending third wave. We don't have that, unfortunately, at this time. So again, from your first question, it now becomes extremely important that South Africans do the non-pharmaceutical interventions, but mostly avoid crowds. These are the major sources of spread. As we've seen in India, that super spreading events from political rallies and religious gatherings has fueled that tragic wave. We do not want to end up in a similar situation. So people now have it in their hands to avoid that. It's not going to come from vaccination at this time, unfortunately.
Okay, very, very wise words there. Thank you so much. Dr. Aslam Dasoo is medical expert and is, of course, also the convener of the Progressive Health Forum. So much for us to take from that interview, but indeed the main one being that it's up to us now to keep each other safe.